All right, so we've spoken a lot about multiple sclerosis, which we said multiple sclerosis is an issue from the nerves, right? So the nerves is actually, that's like the clothing of the nerve, literally. Right? Schwann cells, myelin sheath is getting damaged. All right, you can see it on this other side. So here we just want to talk about the pathology. Pathology is more of like, okay, step by step. How did it actually come to be? You understand? So first of all, you should know that it's a chronic condition. So chronic condition, that's to tell you that it doesn't just wake up then come to be. It has been there over time. All right. The chronic condition is immune-mediated demyelinating disease of the central nervous system. That means it's the immune system that is kind of like what, attacking its own nerves. So it's characterized by what, episodic neurological dysfunction and dissemination lesions in both time and space, meaning multiple attacks and multiple areas of the central nervous system are usually affected by this. All right. So there's demyelination. All right. So first issue is that there's loss of what, the covering of the nerves. All right. So mostly nerves in the what, periventricular white matter, optic nerves and chiasm, brainstem and spinal cord, cerebellum. Okay. So next there's inflammation. All right. So structures start getting inflamed in the body and all of that. Then gliosis. So reactive astrocyte proliferates, right? That they grow. There's glia scar formations and all of that. All right. So there's axonal injuries. Okay. So there's progressive axonal loss. So as you are losing some one or two things, this is what actually leads to what, irreversible issues. Okay. So stages, you have the active plague, you have the inactive plague, then you have the shadow plague. You could actually pause to observe the histological findings right here. All right. So this is the what, immunopathology, disruption of blood-brain barrier, oligoclonal bands in the cerebrospinal fluid. All right. Then you can also have infections from the Epstein-Barr virus. So clinical correlation is there's episodes of dysfunction, all right, followed by recovery, progressive forms, all right, where it's just the steady decline without any clear relapses. So symptoms is there's visual disturbance, there's motor weakness, there's sensory loss, there's weakness, and there's issues with seeing. Okay, so that's it for the pathology of multiple sclerosis.